right, studio time check is 1 o'clock. You are listening to Niger Health Radio, your wellness companion, and this is the Industry Show, the show where we'll bring topical subjects as they pertain to the health sector to the front burner. My name is Demystified, and I am here with Dr. Timothy Akinmurele. Good afternoon, sir.
Good afternoon, Dr. How are you doing?
I am doing well. So I said something off record before we got into the studio. I said, if Dr. Tim is wearing a blazer today, just know that you guys are in for it. But he's dressed a little casual, so well, he might take it easy on you. Trust me, he knows his onions. All right, so today we'll be talking about demystifying health insurance. And this topic is quite important because, in fact, I think this topic is an emergency. It's a public health emergency. I went through something very recently, and it dawned on me that perhaps if I had taken the right step as regards health insurance, some of those things wouldn't have happened. And I know that there are quite a number of people out there who are ignorant. In fact, according to Biomed Central, only less than 10% of Nigerians are on an health insurance plan. And the interesting part is out of that 10%, some of them are on a health insurance plan because, well, it's part of their employment provision. It's that bad. Now, according to the Bureau of Statistics, 40% of Nigerians are living below the poverty line in Nigeria. This only means that if you look at it very well, people are not far from getting to poverty just by one slight serious medical condition. And this is the reason why we're discussing this today. So, sir, what is health insurance?
All right, thank you very much. You already gave a good sense of the importance of health insurance in the country. So, try to put it mildly. Trying to put it in a simple way. Health insurance is simply paying for your health care in advance, such that when you are sick, you don't need to pay a heavy amount of money when you're sick. It's like paying for something when you're healthy, so that when you're sick, you don't have to pay so much for it. And it's just the same principle with any other insurance policy, where you pay a little amount of money right now, where you're not in any danger, you understand, or you're not facing any dilemma. So if peradventure you face such a dilemma in the future, you understand, the little you pay now will take care of the big expense in the future. So that's why it's just people paying for ahead, so that when they are sick, pay little money now. So when you're sick, you don't have to pay a huge amount of money that might, like you said, be hurtful to your pocket, or we call catastrophic health expenditure.
Yeah. Okay, now the challenge is people feel that I'm not going to get sick, God forbid. In fact, the moment you tell someone that you should get on a health insurance plan because you don't know what might happen. Are you pushing me back? Like, what is wrong with you? God forbid, the Lord that I serve will not allow me get sick or fall sick. So why should people get on a health insurance plan, and why do you think people are hesitant about getting on a health insurance plan?
All right, thank you very much. So the first thing you want to know is that one of the worst things that can happen in the health system is when you have to pay out of pocket for health. Everywhere in the world. Health systems try to make sure that you don't pay out of pocket for health because it's way expensive. And I'm talking about very developed countries, rich countries where the standard of living is pretty high and the level of poverty is very low. Yeah. You understand? Top place of the country, Nigeria, where, like you said, most 80%, you understand. A lot of people are living below the poverty line and all of that. So the main reason why you want to pay for insurance is to avoid that catastrophic out-of-pocket payment, which can be impoverishing, meaning that you can tip even the average person into poverty. You just need a big medical expense to tip most people who are living the average life into poverty. So that's the first reason why you want to have a health insurance policy. That you pay little money now. Yes, you're not sick, but that's the idea. So you pay very little money, so that if peradventure, because it's a risk and it's a probability, and that's what economics is all about, risk and probability. So so if you pay that little money now and you pay annually as it were, if you fall sick, you will not need to pay any heavy amount of money. You can get treated. So that's the first reason why you want to get a health insurance, policy, as it were. Of course, the other reason is that you want to guarantee that you can continue making money. If you're sick, you can't make money. You understand? So the idea is that, look, if I pay for a little bit of money now, if I fall ill, I can easily go to the hospital, get treated, and then get back to making my money. But if peradventure you fall ill, and by the time you fall ill, it happened that you don't have any money on you. At that point in time, will be tied, you're in big trouble, and then you have to start borrowing, and it becomes very, very, very difficult. So one of the reasons why you also pay for insurance is that you can keep making the money, and which is tied to each other, because for most people on health insurance scheme, it's easier, to go to the hospital for preventive purposes.
Yes.
You understand? Because if I go for regular medical checkup, and most health insurance policies cover regular medical checkup, you can detect ailments early. You can detect hypertension, diabetes, those non-communicable diseases. You can discover them early, and then you can take care of yourself such that you can take preventive measures. And you don't have to fall. You don't have to wait until it gets severe, and then you get very sick before you detect it. Which is what happens without health insurance. You will need to wait until you are very sick. So health insurance gives a kind of preventive health than if you don't have health insurance. Of course, it also protects your family too, because once you protect yourself, you can protect your family. Everybody's covered under the health insurance scheme. So for me, the basic reason why you want to pay for insurance scheme is just to safeguard yourself, make sure you're healthy, you can keep making the money, safeguard your investments too. Because listening to your show with Sean yesterday, one of the basic things about life is that if you have an investment or a savings and you don't have any health insurance scheme, if you fall ill, you're gonna drain all your savings, all your investments. You understand? So if you want to safeguard your investment, just pay a little money. You understand? While you're not sick. You understand? It's not like you're going to fall sick. Nobody's saying you could, like you said, people say, I don't want to fall sick, so if I pay, it means that I plan to fall sick. Nobody plans to fall sick, but it's a probability that you fall sick. And everybody falls under that same probability. Now, it depends on your premorbid state. That probability can be high or low, depending on what the body system is like, what premorbid conditions you have, what, you understand, what what they call pre-enrollment conditions are. And so whatever it is, you want to make sure that you're covered. Either your risk is high or low. Make sure you're covered so that when you're sick, you don't need to pay the amount of money to treat yourself.
Apparently, enrolling on a health insurance scheme, is quite beneficial. But what could be the, factors contributing to the low response to health insurance? Because this is good. Yet people aren't enrolling. People are not interested. So what could be the factors contributing to this?
All right. So generally speaking, human beings are supposed to be risk averse.
Yes.
That is, theoretically speaking, meaning that we all try to avoid risk.
Yes.
Meaning that whatever will reduce your risk, you want to take them. One of it is insurance.
Yes.
But then when you get to a country like Nigeria, you get some other factors play out. Meaning that, and number one factor is socio-cultural. You understand? Our culture and our minds and our belief, just like you said, is that I'm not going to fall sick.
Wish me
You understand?
sickness.
Exactly. And I'm not going. If you talk to people about paying for it, they're like, look, you think I'm going to fall sick? But that's not true. Everybody will fall sick at some point in time or the other. It just depends on the severity and the ability to take preventive measures that make sure it's not a severe type and you can always manage it well. So the basic problem with why the enrollment level on health insurance in Nigeria right now is still very low is because of, first of all, social cultural. Our culture, our mindset, our upbringing is religious mindset. Everything we tie to religion, we tie to culture. Yeah. And of course, secondly, which is also very important, is the economic situation. Understand? Yeah.
True that.
Yeah. So it's difficult for people who are already living from hand to mouth, as it were. And that's where like 80% of Nigerians fall into the informal sector. So you said something in your introduction that less than 10% of Nigerians are enrolled on the health insurance scheme, and that most of those are on paid employment. They are called the formal sector. The formal sector is regulated. Government can put measures in place. And look, if you have more than 15 employees, you must actually put all of them on health insurance. So it's easier to regulate that space. But the informal sector, where most people fall into, where people live from hand to mouth, artisans, every other person fall into the informal sector that is not organized as a formal sector, it's difficult to regulate health insurance there. And those folks probably cannot appreciate the importance, you understand, of putting little money aside. Although, ironically speaking, it's these same folks that can afford to buy a shoebi of thousands of naira.
Well,
we've analyzed
that
it before.
Is so true. That is so true.
So the idea is that economy is there, but it's also the socio-cultural aspect, the mindset. So we realize that, yes, the economy is pretty bad, but a lot of people within that informal sector too can still afford to make out some money because they understand the advantage of paying for health insurance, such that some money that they actually could save, you understand, from other extravagant or unnecessary expenses. If they understand the importance of health insurance, they can use that to invest in their health and pay upfront so they can get health care without paying a single dime when they're sick. So those are the two main reasons: socio-economic factor, socio-cultural factor, and economic factor. Of course, there's also the awareness. Most people are not aware of the importance of health insurance, which is the information part, which is where organizations like ours come and try to bridge that gap, make sure people get the information, which is what we're having this radio show too, so that people can get the idea and get a sense of the importance and understand how they can benefit immensely from it.
Wow, interesting. Like the part that got me is how people, are more interested in paying for Ashwebi than, ensuring their health. Okay, now, I hear you, Dr. Akinmurele. Yes, get, on a health insurance plan, do this, do that, but how do I even start? Like you said, one of the challenges is the fact that people are not aware. So if people are not aware of the importance of health insurance, definitely means they don't even know how to get on a health insurance plan. So how do they begin? What do they do?
So right now in Nigeria, it's very easy to get to health insurance. I'll just do a bit of breakdown on how the scheme works. So there are two types of health insurance scheme in Nigeria. There's the private voluntary health insurance scheme and there's the social health insurance scheme. Now the private health insurance scheme is one that came first. That's the one that organizations at the formal sector is allowed to enroll on, which uses the health maintenance organization, the HMOs, the ones that everybody needs to pay premium to, and you get. That's the voluntary private health insurance scheme. Now the social health insurance scheme is one that National Health Insurance Scheme is implementing, and also the state health insurance scheme. Okay. Now how is it different? The private one is voluntary. Yes. Although it's made a bit mandatory because there's a policy, government policy says that if you have a certain number of employees, you must put them on health insurance scheme as part of the statutory benefits as workers. But for the informal sector, that doesn't apply to them. It's difficult to enforce it. Plus, the number of employees you have does not apply to the informal sector. Those barely have more than 5 or 10 employees. Now, the social health insurance scheme is compulsory, it's mandatory. So what every state has done is to legislate social health insurance scheme as a compulsory policy for every citizen of the state. Wow. So across all the 36 states of Nigeria, including FCT, practically every state have legislated compulsory health insurance. You understand? Now, that social health insurance is a one-size-fits-all, which is the difference. So for the private health insurance, which is the HMOs run, those ones have what we call different packages: gold, premium, platinum, all kinds of packages, and it could range from simple, primary health care to as high as medical taking you abroad for treatment, organ transplant, depending on the premium you pay. That is for the private health care. But for the public health insurance, for the compulsory social health insurance, it's a one-size-fits-all, because that is the only way you can reach everybody. Okay. So everybody in the country, in every state of the federation, is mandated to be on that social health insurance scheme. And the premium is very low, and it's a one-size-fits-all. I think it's ranging from like 12,000 naira per annum, a bit over 12,000, maybe to maybe 15,000. You understand? Per individual now. There are some states have family packages, some don't. Some, you understand, just pay 12,000 or thereabouts. If you have 20 people in your family, you pay for those 20 people. Normal package for family, depending on the state, and I can't get very specific here. So the idea is that once you pay for the social health insurance scheme, you are covered for this primary and secondary care. Now, why I'm going into all these details is that it's easy to get enrolled. Now, any state you are in the country, wherever you are, just look for your state health insurance scheme. In fact, they are making it so decentralized. For example, in Lagos State now, they have agents all over everywhere. You understand?
Really?
Yeah, they're selling health insurance like they're selling recharge cards, so that you can always pay for the pay your premium and get enrolled.
I bet a lot of people didn't know that.
Exactly. So when it was just the HMOs implementing the private insurance, which was more or less voluntary, or if you're working for a big organization, makes mandatory. Social health insurance scheme is now mandatory for everybody, and it's easy to enroll, and it's cheap, it's affordable. Let me not say cheap, it's affordable, and it gives you good benefit package, which we'll talk about later. If you get to that question. So to on how you can enroll, wherever you are, honestly speaking, just Google the health insurance scheme of your state, or ask in any hospital, in any of the states you are, any public health, even the private hospitals too, because they're ensuring that every public and every private hospital in every state gets on those state health insurance scheme. It is mandatory, but enforcing that mandatoriness is difficult, because it's difficult, especially for the informal sector.
Yes.
When you can't go after every mechanic, every tailor,
seller,
every barber on the street, you understand? So it's difficult, but they are trying, you understand, to make it work. So to the extent that it's easy right now to enroll on a social health insurance scheme, which is what I recommend for every single person listening to this program. Get to your state, Google your state health insurance scheme. Just you will find that the very hospital next to you, has information that can help you. If not the public or the private hospital, they always get that information, get you the information you need to get enrolled on the health insurance scheme.
You see what I said? I said that you're going to learn a lot. I mean, even I didn't know that it was that easy to get enrolled on a health insurance scheme. All right, before we continue with the conversation, we would go on a short commercial break. You're still listening to Nigeria Health Radio, your wellness companion.
Dear Lagosians, the attention of the Lagos State government has been drawn to the unprofessional practices of some healthcare facilities in the state who engage in quackery and other vices. These unethical practices could compromise the health status of patients and undermine the huge investment of government in qualitative healthcare delivery. Hence, any healthcare facility owner or operator found perpetrating these acts will be prosecuted accordingly and the facility sealed. To avoid being sanctioned, the Health Facilities Monitoring and Accreditation Agency, HEFAMA, hereby advises owners and operators of facilities to complete their online registration or renewal using the HEFAMA e-portal, collect the agency's logo and display it at a position in the premises where members of the public can see it. Similarly, members of the public are advised to be vigilant and patronize only government-accredited health facilities with HEFAMA logo or proof of registration with the agency. Report those behind illegal operations to the agency for prompt action. We implore you to cooperate with and support the Babajide Sanwo-Olu's administration in fighting against quackery and illegal operation of facilities to safeguard the health and well-being of all Lagosians. For more information, clarification, or complaint, visit the agency's office at Plot 6, Alaja Ashabi Cole Street, Tisco Plaza, CBD, Alausa Ikeja. Call 0901-563-7023, 0905-727-3396, or visit hefama.lagostate.gov.ng. Good health is the responsibility of all.
Alright, welcome back to the industry on Nigeria Health Radio, your wellness companion. My name is Demystifying, and I am here with Dr. Timothy Akinmurele, the CEO of Equitable Health Access Initiative. He did like this.
Peace out.
Oh my goodness. Alright, so we've been talking about, health insurance. He has been demystifying health insurance for us, and honestly, I have learned a lot. I didn't know that, enrolling on a health insurance scheme was that easy. Really, it's that easy. All right. So Dr. Timothy Akinmurele is a public health professional with over 18 years experience, and he has spent 12 of those 18 years, managing the implementation of massive public health intervention programs. He has contributed significantly, I beg your pardon, to Nigeria's response to the fight against HIV, malaria, tuberculosis through PEPFAR and the Global Fund intervention projects. see who we brought for you. You know, someone that knows something, a seasoned professional, I tell you, a seasoned public health professional, I tell you. All right, sir. So before, you know, we went on that short break, we're talking about the social health insurance scheme, and then we also spoke about the private, you know, health insurance scheme, which is the HMO and all. And you know, you mentioned that for the social health insurance scheme, you can get on a package that is as low as maybe, you know, 12,000 naira.
12,000 naira
Yes.
per month for most states.
Yeah, so which is really affordable, but Nigerians, we don't like anything that seems too good to be true. I just think it's a, I don't know how we got here. But when something is seeming too good to be true, I just skeptical, like what's going on. So what conditions does a health insurance plan you know, cover? How much does it cover?
All right, so it's called benefit package.
Okay.
Like I tried to, you know, delineate the two parts. A private health insurance scheme, which is the voluntary one, HMOs run. Those ones have various packages depending on how much you pay. For the social health insurance scheme, it's a one size fits all. And the idea behind that is that you want to get everybody on the health insurance scheme. Insurance is a game of numbers. You understand? The more people you have on board, the more money you have. You understand? And the more you can provide. You understand what I'm saying? So now, what is the benefit package for the social health insurance scheme? It covers primary healthcare services, secondary healthcare services, and that's saying quite a lot.
Okay.
It covers every disease you can think of.
Wow.
You understand? Yeah. It covers everything. So you start from the primary healthcare, which is where your entry point.
Yes.
If you require referral, if they can take care of your ailment, then you get it. If it's a bit more than that, they can refer you to a secondary healthcare facility. So it covers everything from outpatient care to admission to surgeries to antenatal care, treatment of common disease, malaria, typhoid. Everybody gives them the hospital treatment typhoid and malaria. It takes care of hypertension, diabetes. It takes care of any form of non-communicable disease you can think about.
Okay.
It takes care of antenatal care, including cesarean section. I'm talking of for just 12,000 naira per month. You can get and it works. It works.
Wow.
It works because everybody's putting money together. Not everybody will fall in at the same time. That's the principle behind it. So the fact that you're putting money in a place and you're not using it, your next door neighbor or your brother, your sister, or your uncle might be using that same fund because you put money in the same pool. That's the principle behind health insurance. So it's more. It's also a social good. It's also what we call it again. I can't remember what it's called now. I forgot what it's called in economics. But the idea is that it gives a lot of externality, such that the fact that you're putting money in a pot and you're not using it because you're not falling ill doesn't mean others are not benefiting. And if one day you need it, you have access to it. So it covers a whole range of services that the benefit package is very long. But those are just the broad headings on which they come under: inpatient care, outpatient care, admissions, surgeries, minor surgeries. You can do appendectomy, you can do herniorrhaphy, you understand? I'm sure you can do some major surgeries. But by and large, those are 90% of the problem people have are those. You understand?
Yes.
Very few people will have what require more.
Yes.
You understand? So, and the other thing is that for those that do above that 90%, they get to that level because they didn't detect early. So if you have, that's why I said that if you have health insurance, you are able to detect those things early because you have access to the facility. You can visit the facility. Once you have a slight headache, you can go to the facility.
You can actually nip
it in the bud, exactly, such that 90% of your problems are taken care of. So those that go to the 10% that require those major stuff that are very expensive are those that most likely didn't detect early. And they waited perhaps because they didn't have any money in their pocket, they had no health insurance coverage. So until it's really bad, then they go to the hospital and then they tell them, oh, if you had come 3 months ago, you will have been able to now your hypertension is a bit too high, you are going into stroke. Meanwhile, if you are having a slight headache or you have been doing your regular checkup, you are seeing your BP was 140/90, which is borderline, they can put you on diet, they can put you on exercise, bring it down. But you don't do that because you don't have health insurance. You go when you have a headache and you're already getting into a stroke, cerebrovascular stroke, and then you spend millions of naira or 100,000 naira because you need admission and you need some high level of care. So that's the idea. Have access to preventive and early treatment and diagnosis, and then you don't have to pay too much money.
I won't even lie, that part got me teary. I mean, think about it. Think about the times that, you had a little headache and you could have just gone to the hospital, but because
Absolutely.
you're considering money, like I don't have the money
Yeah,
now, I have only
absolutely.
2,000 naira with me, I have to
Absolutely.
eat, we have to cook soup,
Absolutely.
and you didn't go to the hospital, and it just grew into something much more complicated.
That's what it
And
is.
you had to start. The funniest thing about sickness is somehow you look for that money. Like somehow you begin to run around, look for where to borrow. Somehow that money you think you didn't have,
Absolutely.
you will look for
That's
it and you would get it. Okay, so sir, I want to speak for people like me, not me too. I'm speaking for some people that feel like, okay, sir, I get you. 12,000 naira is really low, but is it possible for it to go lower? So do you think that there is something that the government can do to further subsidize, the funds for health insurance?
So like I said, insurance is a game of numbers. You understand? So what the actuarials have done to get to whatever premium they have now, I'm talking on the social health insurance scheme now, not the private one, is that they've done some analysis, you understand, based on population enrollment. But I can assure you that as more people enroll, the premium can either come down or the service provision goes up. You either reduce the cost or you increase the debt. You understand? In fact, you can get to a stage where you can be doing organ transplant and all of that if you have enough money in the pool. So what's the government doing quickly? The government can subsidize that 12,000 because it's an actuarial study and it's a business. What the government has done is to provide what we call funds for vulnerable population. Now there are some people who are really poor, poorest of the poor. Exactly, really poor, indigent people. So the government, federal government, state government, they're making some provisions for those ones. You can talk about that. That's a whole topic on its own. How government is trying to help vulnerable people, call them, special population, so that they identify the poor of the poor and enroll them free of charge. And they run into hundreds of thousands of people in every state. So those ones are helped, but for the premium, the way it can come down in my professional view is as you get more people on board, you can do a recalculation of actual, bring it down, or you can increase the depth of the coverage, so you can do more for the same amount of money. But for government, they're just helping vulnerable population and helping people who cannot afford it to be able to afford it, so that the pool also grows and more, and they can provide more.
Oh well, I have a lot of questions to ask, but our time is so far spent. But he said something about talking about how the government is trying to help vulnerable people. So we'll definitely be discussing that in subsequent programs. Thank you so much for coming, Dr. Timothy Akinmurele. That was a lot within that short period of time, and I have other questions, but we'll just move them to maybe next week when we'll come to you again. You're listening to The Industry on Niger Health Radio, your wellness companion. I have been having this interesting, although a little serious tete with Dr. Timothy Akinmurele. I have learned a lot, and at one point really I was trying hard not to cry, really, because I thought of the number of people that have passed on to the great beyond because they didn't have information.
Absolutely.
Now you have heard it. You can ask questions on our social media platforms at Niger Health Radio. Ask your question. We would take these questions to Dr. Timothy. He would answer them, and you can get enrolled on a health insurance scheme. It is so important. Like, we can't even overflog this. Like, it is so important. All right, we'll come your way again next week, same time, same link. Do enjoy the rest of your day. Bye.
Thank you very much.
Niger Health Radio. Health infotainment just got better.
You are listening to Niger Health Radio. Your well